Have you ever thought that there are silent dangers in our bodies? Blood clots are one of them, and they can cause serious consequences. These clots not only block the normal flow of blood, but can also travel to the heart, lungs or brain, causing serious warnings. Any one of us is at risk. When blood clots attack, the consequences are really dangerous, mention stroke, heart attack, or respiratory failure. Let's find out with us the 12 most important signs, helping you recognize the danger in time, protecting your life. Sign 1, swelling. Unusual swelling can be an early sign of potential danger in the body. This phenomenon is not simply a small problem, but sometimes can be a warning of a blood clot. The mechanism of swelling occurs when a blood clot forms in a blood vessel, blocking the normal flow of blood. As a result, fluid and blood accumulate, creating a noticeable swelling, especially in the legs or arms. Areas of swelling caused by blood clots are often characterized by mild pain when touched and have a different feeling than areas of swelling caused by impact. You may feel a dull pain when moving or standing for a long time. Swelling caused by blood clots is not just swelling in one area, but is sometimes accompanied by redness indicating inflammation. The skin around this area may be hot, and have an unusual appearance. Ignoring swelling can cause serious complications such as blood flow obstruction, pulmonary embolism, or even the risk of myocardial infarction. Long-term swelling can increase the risk of infection or tissue necrosis. In particular, infection in this condition can lead to complications that are difficult to treat. In addition to pain, swelling also has a long-term impact on movement and daily activities, causing the patient to lose comfort in life. If you find that your body has strange swelling signs, quickly contact your doctor for timely advice and treatment. Sign 2, pain or sensitivity. Sudden pain and sensitivity are an important sign that your body may be in danger. This phenomenon is not just a mild pain, but sometimes it can be a warning from a blood clot. The pain mechanism occurs when a blood clot forms in a blood vessel, blocking normal flow. Increased pressure in the blood vessels causes the nerve endings to become irritated, creating a dull ache and pain. Blood clot pain is not like normal pain. Initially, you may feel a dull ache, like a heavy pressure area. These symptoms will gradually increase over time, becoming stronger when you try to move or stand for too long. Pain is often associated with blood clots blocking the flow of blood. When blood clots move, they can cause symptoms of pain that spread to organs such as the lungs, heart, or even the brain. When pain suddenly appears without a clear cause, especially when accompanied by swelling, redness, or an unusual feeling of heat, you should be careful. These signs are not to be ignored, but can be an emergency signal. Sudden and increasing pain is not a symptom you should ignore. See a doctor immediately to screen for danger and receive timely care. Sign 3, redness or discoloration. When an area of skin suddenly turns red or discolored, but you haven't had any contact with it, such as sunburn, a scrape, or a bump. This could be an early sign of a blood clot in a blood vessel. A blood clot can block blood flow, causing fluid to build up in the veins under the skin. This often leads to inflammation of the blood vessels, accompanied by redness, discoloration, and a feeling of warmth to the touch. Redness or discoloration caused by a blood clot usually doesn't go away quickly. The area is usually quite noticeable, swollen, warm to the touch, and full of discomfort. Redness occurs when blood is blocked from its normal flow. The accumulation of blood or fluid in the veins and tendons of the skin leads to an inflammatory reaction. This is a sign of emergency. Redness or discoloration is not normal. When you have additional symptoms such as pain, pleasure, or a feeling of heat, you are at risk of having deep vein thrombosis or a dangerous blood clot. If you notice these signs, do not be subjective. Quickly contact your doctor for examination and timely advice. This can help you prevent more serious dangers. Sign 4, feeling unusually hot. A sudden feeling of heat in an area of the body, without any obvious cause such as movement or impact. This could be one of the early signs of a blood clot. A blood clot in a blood vessel can block blood flow, increasing pressure in the vessel and leading to inflammation of the surrounding tissue. This condition often causes a distinct feeling of heat when touched to the skin. Areas that are unusually hot are often accompanied by mild pain, redness, and possibly a slight tingling sensation. This is a sign that a blood clot is blocking blood flow in this area. An unusual feeling of heat, especially when accompanied by other symptoms such as tingling or redness, can be a dangerous sign of deep vein thrombosis. This condition can be life-threatening if not treated promptly. If you notice an area of skin that feels unusually hot, you should not ignore it. Watch for signs of heat, redness, or mild pain, and see your doctor promptly for an urgent checkup. Unusual heat, if left untreated, can lead to infection or serious complications such as tissue necrosis. This can have long-term effects on your health and quality of life. Sign 5, cramps. Sudden cramps, especially if they occur repeatedly and without a known cause, can be an early sign of a blood clot in the body. When a blood clot blocks a blood vessel, the supply of oxygen and blood to the muscles is interrupted, causing cramps. This spasm is often sudden and accompanied by severe pain. A blood clot cramp is not like a regular cramp when you exercise. It can occur when you are resting, standing for a long time, or even sleeping. The area where the cramp occurs often feels numb and the muscles feel tight. Recurrent leg cramps are not just a temporary problem. When the cramps are accompanied by symptoms such as mild pain, redness, or tingling, it can be a dangerous sign of deep vein thrombosis. When left untreated, leg cramps can affect your quality of life and make it difficult to move. The underlying cause, deep vein thrombosis, can have more serious consequences if left untreated. Recurrent leg cramps, especially if you feel numbness in your fingers or toes, should be checked by a doctor immediately. Timely examination helps you detect and handle the risk right away. Sign 6, shortness of breath. Sudden shortness of breath, especially when you are resting or not moving much. This can be one of the most dangerous signs of a blood clot. Shortness of breath occurs when a blood clot travels to the lungs and blocks one of the important arteries. The flow of oxygen in the body is suddenly reduced, causing a feeling of suffocation. In addition to difficulty breathing, you may feel faint, dizzy, or feel like your heart is beating abnormally fast. These are unpredictable symptoms but can be very dangerous. Shortness of breath due to a blood clot often signals a serious condition such as pulmonary embolism. This condition can be life-threatening if not treated promptly. If you suddenly feel short of breath for no apparent reason, contact your doctor immediately. Timely examination can help detect dangerous conditions and prevent serious complications. Sign 7, chest pain. Sudden chest pain, especially when it feels sharp or heavy, is not only a sign of a heart attack but can also be a sign of a moving blood clot. A blood clot in the pulmonary artery can cause chest pain, especially when the blood clot blocks the supply of oxygen to the heart. This condition is dangerous and can cause serious complications. In addition to chest pain, you may experience shortness of breath, dizziness, or lightheadedness. The pain may increase when you breathe deeply or lie on your back. Chest pain caused by a blood clot can signal a dangerous condition such as a pulmonary embolism or a heart attack. Early detection can help prevent serious consequences. If you experience unusual chest pain, especially if it is sharp or accompanied by difficulty breathing, call 911 or contact your doctor immediately. Prompt treatment can save your life. Sign 8, unusually rapid heartbeat. A sudden rapid heartbeat, especially when you are resting or not moving, can be a telltale sign of a blood clot. A rapid heartbeat occurs when a blood clot blocks part of a blood vessel, forcing the heart to work harder to supply oxygen to the body. In addition to a rapid heartbeat, you may feel lightheaded, dizzy, or as if not enough blood is getting to your brain. Recurrent rapid heartbeats without anxiety or exercise can signal a dangerous condition such as a pulmonary embolism or a heart attack. If you experience an unusually rapid heartbeat, seek medical attention immediately. Prompt intervention can save your life. Sign 9, dizziness or lightheadedness. Sudden dizziness or lightheadedness is not normal, especially when it occurs while you are resting. Dizziness can be a sign that blood flow to the brain is reduced due to a blood clot. In addition to dizziness, you may feel unsteady or lose control for a moment. Dizziness due to blood clots can signal a stroke or a blood clot in a major blood vessel. If you suddenly feel dizzy or lightheaded, stop all activities immediately and contact your doctor. Signs such as shortness of breath, chest pain, coughing up blood or lightheadedness should not be ignored. These are important warning signs of a blood clot, which can be life-threatening. Listen to your body and pay attention to unusual symptoms. Timely detection and medical advice are important to protect your health. To protect yourself and your family, maintain a healthy lifestyle, increase physical activity and maintain regular screenings. Remember that early recognition of risks and timely action can reduce the risk to a minimum. Together, we can protect a healthier life.